Mesothelioma is a rare and aggressive cancer. It affects the lining of the lungs, heart, or abdomen. This lining is called the mesothelium. Mesothelioma is a serious disease. It can impact breathing, heart function, and digestion. Mesothelioma often develops many years after exposure to asbestos. This makes it crucial to understand the risks associated with this material. While there is no cure for mesothelioma, treatments can help manage symptoms. Early detection is important. If you have been exposed to asbestos, regular checkups are crucial. This allows for timely intervention and better management of the disease. Knowledge is power when it comes to mesothelioma. Understanding the disease, its causes, and treatment options can empower patients and their families. This essay aims to provide comprehensive information about mesothelioma, offering guidance and support to those affected. Asbestos is a naturally occurring mineral. Its fibrous properties made it a popular building material for decades. However, asbestos fibers pose a serious health risk when inhaled or ingested. These tiny fibers lodge themselves in the mesothelium, causing irritation and inflammation. Over time, this chronic inflammation can lead to DNA damage. The damaged cells can then multiply uncontrollably, leading to mesothelioma. The latency period between asbestos exposure and mesothelioma diagnosis can be 20 to 50 years. Many people exposed to asbestos decades ago are only now facing a diagnosis. This highlights the long-term danger of this material. Despite its known risks, asbestos is still not fully banned in many parts of the world. This continued use poses a threat to unsuspecting workers and communities. It is essential to raise awareness about the dangers of asbestos and advocate for its complete ban. Mesothelioma is a global health concern. It affects people from all walks of life. However, certain occupations are at a higher risk due to past asbestos exposure. These include construction workers, shipyard workers, and firefighters. People living near asbestos mines or factories are also at an increased risk. Asbestos exposure can occur in homes and buildings built before the 1980s. Asbestos was commonly used in insulation, flooring, and roofing materials. Disturbing these materials during renovations can release harmful fibers into the air. It is vital to have homes and buildings tested for asbestos before undertaking any renovation work. Protecting yourself and your family from asbestos exposure is crucial. If you suspect asbestos in your environment, contact a qualified professional for safe removal and disposal. Receiving a mesothelioma diagnosis can be overwhelming. Understanding the disease is the first step towards coping with this news. Mesothelioma is classified into different types based on the location of the tumor. Pleural mesothelioma affects the lining of the lungs and is the most common type. Peritoneal mesothelioma affects the lining of the abdomen. Pericardial mesothelioma affects the lining of the heart and is the rarest type. The stage of mesothelioma indicates the extent of the disease. Staging helps doctors determine the best course of treatment. It is important to have open and honest conversations with your healthcare team. Ask questions, express concerns, and seek support from loved ones. Remember, you are not alone in this journey. Section 5. Seeking answers. Diagnosis and staging. Diagnosing mesothelioma involves a combination of tests and procedures. Imaging tests, such as X-rays, Connecticut scans, and MRIs, provide detailed pictures of the affected area. Biopsies involve taking a small sample of the tumor for microscopic examination. This helps confirm the diagnosis and determine the type of mesothelioma. Staging may involve additional tests, such as PET scans and blood tests. These tests help determine the extent of the cancer's spread. The staging system used for mesothelioma is complex. It takes into account tumor size, lymph node involvement, and the presence of metastasis. Accurate staging is crucial for treatment planning. It helps doctors determine the most effective approach for each individual case. Section 6. Navigating treatment. A multidisciplinary approach. Treating mesothelioma requires a multidisciplinary approach. A team of specialists works together to develop an individualized treatment plan. This team may include oncologists, surgeons, radiologists, and palliative care specialists. Treatment options for mesothelioma vary depending on the stage of the cancer, the patient's overall health, and their individual preferences. Surgery, radiation therapy, and chemotherapy are the mainstays of mesothelioma treatment. These therapies can be used alone or in combination to target cancer cells and manage symptoms. The goal of treatment may be curative or palliative. Curative treatment aims to eliminate the cancer completely. Palliative treatment focuses on relieving symptoms and improving quality of life. Section 7. Surgery, removing the threat. Surgery is often recommended for early-stage mesothelioma. The goal of surgery is to remove the tumor and as much of the affected tissue as possible. The type of surgery performed depends on the location and size of the tumor. Pleurectomy decortication, or PD, is a common procedure for pleural mesothelioma. PD involves removing the lining of the lungs and the tumor. Extrapleural pneumonectomy, or EPP, is a more extensive surgery. EPP involves removing the lung, the lining of the lungs, the diaphragm, and part of the sac surrounding the heart. Surgery carries risks, such as bleeding, infection, and breathing difficulties. The decision to undergo surgery is a complex one. It requires careful consideration of the risks and benefits. Section 8. Radiation therapy, targeting cancer cells. Radiation therapy uses high-energy rays to kill cancer cells or stop them from growing. It can be delivered externally or internally. External beam radiation therapy involves directing radiation beams from a machine outside the body to the tumor site. Internal radiation therapy, also known as brachytherapy, involves placing radioactive material directly into or near the tumor. Radiation therapy can be used before surgery to shrink the tumor or after surgery to kill any remaining cancer cells. It can also be used to relieve symptoms, such as pain and shortness of breath. Side effects of radiation therapy can include skin irritation, fatigue, and loss of appetite. These side effects are usually temporary and manageable with medication and other supportive measures. Section 9. Chemotherapy, attacking cancer systemically. Chemotherapy uses drugs to kill cancer cells throughout the body. It can be administered intravenously, orally, or directly into the chest or abdomen. Chemotherapy drugs work by interfering with the growth and division of cancer cells. It can be used before surgery to shrink the tumor, after surgery to kill any remaining cancer cells, or on its own to slow the progression of the disease. Chemotherapy side effects vary depending on the drugs used and the individual patient. Common side effects include nausea, vomiting, hair loss, and fatigue. These side effects are usually temporary and manageable with medication and other supportive measures. Your healthcare team will monitor you closely for side effects and adjust your treatment plan as needed. Section 10. Hope for the future, clinical trials and emerging therapies. Researchers are constantly working to develop new and more effective treatments for mesothelioma. Clinical trials are research studies that test new drugs, combinations of drugs, or new approaches to surgery or radiation therapy. Participating in a clinical trial can give patients access to cutting-edge treatments that are not yet widely available. Emerging therapies for mesothelioma include immunotherapy, targeted therapy, and gene therapy. Immunotherapy helps the body's own immune system fight cancer. Targeted therapy uses drugs that target specific molecules involved in cancer cell growth and survival. Gene therapy involves altering the genes of cancer cells to kill them or stop them from growing. These exciting advancements offer hope for the future of mesothelioma treatment. Section 11. Life after diagnosis, support and resources. A mesothelioma diagnosis can be life-changing. It is important to remember that you are not alone in this journey. Support is available for patients and their families. Support groups provide a safe and supportive environment for sharing experiences, coping strategies, and emotional support. Mesothelioma organizations offer valuable resources, including information about the disease, treatment options, financial assistance, and legal rights. Palliative care specialists can help manage symptoms, improve quality of life, and provide emotional and spiritual support. Remember to take care of yourself both physically and emotionally. Eat a healthy diet, stay hydrated, get enough rest, and engage in activities you enjoy. Living with mesothelioma can be challenging, but there is hope, support, and resources available to help you navigate this journey.